Over the last 7 days, Iowa has seen an increase of more than 22,000 new COVID-19 cases and an average statewide positivity rate of 17.5%. This is a decrease from the 7 days prior when new cases totaled 36,000, and the average positivity rate was 28%. At a county level, we're seeing that positivity rates are beginning to stabilize in many areas, and these are welcome signs. And while we may be cautiously optimistic, we have a whole lot of work to do to bring the numbers down to a level where we can safely manage the virus while getting life back to normal. Hospitalizations remain high across the state, but yesterday was the first day in weeks where we saw a slight decrease in the overall number of Iowans hospitalized. So this gives us hope as well, but one day is far, far, far from a downward trend. Over the next week, it will be critical that we see hospitalization rates begin to stabilize. Every day, we are monitoring it closely and working directly with hospitals and healthcare systems to understand their situations and assist as needed. The vast majority of those hospitalized continue to be older Iowans. Currently, 74% of all hospital patients with COVID-19 are age 60 and older, which again underscores the importance of taking measures to protect those that are most at risk, whether due to age or underlying health conditions. As we approach the holiday season and even small gatherings occur among family members, we just need to be mindful of how our behaviors could impact others. Give you an update today on long-term care facility outbreaks. Later today, an additional 20 long-term care facility outbreaks will be reported. And just as a reminder, a facility moves to outbreak status when 3 residents in the facility test positive for the virus. That will bring the total number of active long-term care outbreaks at this time to 114, and I think we have somewhere around 443 long-term care facilities. This afternoon, we also will do an update to the long-term care dashboard on coronavirus.iowa.gov, and it will report the number of new cases. The additional information will report the number of new cases over the past 14 days in facilities with active outbreaks. News of long-term care outbreaks is, very concerning as it impacts our most vulnerable population. And as we saw earlier this year, the consequences of COVID-19 in these facilities can be devastating for residents and their families. The Department of Public Health and members of my team are also in regular communication with the long-term care associations and partners on how best to help facilitate during these challenging times. We're ensuring that that adequate infection control measures are in place. To make sure that they are in place is critical to preventing the virus from entering a facility or stopping its spread after an exposure. Training is available on infection control, appropriate PPE use, and emergency planning. And in an effort to more effectively assist long-term care facilities with staffing concerns, the state has provided updated guidance on preparation and implementation of emergency staffing plans. The State Hygienic Lab continues to support our long-term care facilities with testing needs, including when an outbreak occurs. So in addition, the lab is also providing Bionex Now antigen test cards to support routine surveillance testing, and more than 240,000 cards have been distributed to facilities across the state for this purpose. I'm also announcing today that $14 million of CARES funding will be allocated to Iowa's long-term care facilities to assist with the increased cost related to testing and staffing. Like our hospitals, it's important that we also provide assistance to long-term care facilities at this time, and that every Iowan continues to do their part to protect the most vulnerable of our healthcare workforce. Also, as positive cases have increased, so has the caseload for investigations conducted by public health departments, whether at the state level or locally. The volume of cases at this time requires additional resources, and as we announced earlier this week, we are working to increase our case investigation resources. In the meantime, it's important that Iowans are prepared in case they or someone in their family tests positive. So today I've asked Dr. Padati to help inform Iowans about what they need to do if a member of their immediate household tests positive for COVID-19. Dr. Padati.
Thank you, Governor Reynolds. So I want to talk a little bit about two traditional public health activities that we do for a variety of diseases and have done for a long time. And those are both case investigation and contact tracing. So when we talk about case investigation, we're talking about an individual who has received a positive COVID result. So they're infected with the COVID-19 virus, regardless of whether or not they have symptoms. We reach out to those people and ask questions about them, and we do that for a couple of reasons. Partly because we want to understand a little bit about these people and who the virus is affecting, right? So your age, maybe your underlying health conditions, what you do for a living, and that helps us better understand a virus that, remember, we haven't known about for just under quite a year now. So as we get a little bit more information about the individual and who they are, we also try and understand a little bit about what activities they might have participated in that could have put them at risk for becoming sick. Now, because this is a person-to-person virus, it can be a little bit hard to know that for certain, especially as people engage in increasing numbers of activities, which we do see. But when we've identified that person who's a case, so that's somebody who's infected with COVID, the public health recommendation is to stay home for 10 days, and we call that isolation. And so anybody who has received a positive result indicating that you have COVID-19, we ask that you stay home for a 10-day period, either from the beginning of your symptoms or from the day you got that test positive if you never had symptoms. And we do that to limit the spread of the virus to other people. Now, in addition to that, in the course of those conversations, we ask people about who else they've been around. And as numbers have increased, we've increasingly focused on high-risk situations, which includes households. Now, we know that households are a place where all kinds of illnesses can spread quickly, whether we're talking about flu or norovirus. When we live together, there are more chances for a virus that moves from one person to the other to move between us. And so we want to help do what we can to protect other people who may have been exposed and are at higher risk from becoming sick. And so that means we start to talk about quarantine, which is the recommendation for healthy people who have been exposed to somebody with COVID to stay home themselves. And we ask people to do that for 14 days, regardless of whether or not they have a negative test. And the reason is because you could still be incubating the virus, or you just might not have become sick yet. And so by asking people who are sick to isolate and stay home, and by asking people who are exposed to someone with COVID to quarantine and stay home, what we're trying to do is limit the spread of this virus from one person to the other. And so it's important that everybody continues to follow that public health recommendation. Now, even if you don't fit into either of those two categories that I just described, people who we ask to isolate or people who we ask to quarantine, I want to remind everybody that there are things that we can all do to help limit the spread of this virus and optimize outcomes for vulnerable Iowans and maintain our healthcare resources. And I know you've heard this before, but that continues to be things like frequent hand washing, using face coverings, and social distancing. And those things are going to continue to be really important for the coming months. I want to acknowledge that I know that there are many people who are tired and that this has been hard, but there are some good things that we're starting to learn around vaccines and around immunity. And so I would ask every media outlet, every person watching at home, please help public health, your public health professionals, your healthcare professionals, share these messages about what you can do to stay healthy. I would think about the people you love and the people who love you and recognize that there are things that we can all do to help keep people safe and healthy, especially during this holiday season. Public health cares very much about every single person here in Iowa, and we're going to continue to work together to help keep people safe and healthy this holiday season. Thank you.
Thank you, Dr. Padati. This information, I think, will be very helpful for families to know what to do if they're faced with this situation, especially as we have our college students returning home over the coming days for the Thanksgiving holiday. So I appreciate your information. Since March, as Dr. Padati indicated, you've heard countless times from me, from Dr. Padati, from the Iowa Department of Public Health, and from your local public health officials about the things that you can do to reduce the risk of getting and spreading COVID-19. Social distance, wear a mask, wash your hands, stay home if you're sick, all very simple steps that truly are the best defense against the virus. And though you may have grown tired of hearing it, it's even more important now to blanket every corner of the state with this message so that we can help stop the spread of the virus while keeping our businesses open, our kids in school, and our hospitals stable and our essential workforce healthy. In partnership with the Iowa Broadcasters Association and the Iowa Newspaper Association, we were able to leverage special programs and pricing to deliver public service announcements through Iowa's local newspapers, radio stations, and television channels, keeping important messages front and center, and I enlisted the help of some familiar Iowans who are uniquely qualified to help carry the message. From former Governor and U.S. Secretary of Ag, Tom Vilsack, who also knows firsthand the importance of bringing Iowans together for the common good. Suresh Gunnasekharan, CEO of UIHC, and Katie Witt, a Test Iowa nurse, each who have a frontline perspective of how the virus is impacting our state and understand better than most why it's so important that every Iowan does their part. Dan Gable, legendary Iowa wrestling coach, Olympic gold medalist, and recent recipient of the Presidential Medal of Freedom. Dan knows what it takes to win, even in some of the most challenging situations. And Carson King, a role model for doing the right thing for the greater good and the incredible difference that it can make for others. So I want to thank each of them for being a part of this campaign and helping us engage Iowans at this most critical time. And now I'm pleased to share one of the television spots that will go out this week. COVID-19 isn't stronger than Iowans' resolve to overcome it.
Together, we can stop the spread of the virus and get life back to normal.
By taking simple steps to protect ourselves and others.
Wear a mask and maintain social distance.
Wash your hands and disinfect commonly used items.
Stay home if you're sick and get tested if you think you have COVID-19.
If you do, isolate from others to avoid spreading the virus.
And get the flu shot so you can prevent further illness and preserve our healthcare resources.
Doing these things will protect you.
And those at most risk for serious illness due to age or other health conditions.
The health of all Iowans relies on every single one of us.
We have a personal responsibility to do everything we can to protect each other.
And keep our state healthy and strong.
Let's step up.
Let's step up.
Let's step up.
Let's step up.
Let's step up and stop the spread together. The Iowa Broadcasters Association is now distributing 2 television spots and a radio spot to more than its 200 member stations across the state. So you'll be seeing and hearing this message soon. The spots are scheduled to air through mid-March. And earlier this month, we worked with the Iowa Newspaper Association where they began placing print and digital ads in its more than 250 member newspapers and online publications across the state, and even further expanded our reach to include Spanish and specialty publications. So again, I want to thank the associations for helping us effectively reaching Iowans with this message, and I want to thank the Iowa Department of Cultural Affairs for their teamwork in producing it, Secretary Vilsack, Suresh, Katie, Carson, and Coach Gable for helping to rally Iowans to step up and stop the spread. So in closing today, I want to just make sure that Iowans are aware of the upcoming holiday hours next week at the Test Iowa drive-through sites. All sites will be open for normal testing hours Monday through Wednesday, except for the Council Bluffs site, which will close early at 2 p.m. on Wednesday, November 25th, so that we can get the samples transported to the lab that day and processed overnight along with those from the other sites. And this will ensure that individuals who were tested will still get their results in a timely manner. All Test Iowa Drive sites will be closed on Thanksgiving Day, but all sites will reopen for testing on Friday, November 27th, as usual, from 8 until 4 p.m. And I really do want to thank the State Hygienic Lab, Dr. Pentella, and all of the Test Iowa staff for making it possible for Iowans to continue to be tested over the holiday. It's a critical time for our state, and testing is so important, and I want you to know how much we all appreciate your service to your fellow Iowans, not only next week, but every single day. So thank you, and with that, we'll go ahead and open it up for questions.
Governor, could you explain the 20 additional nursing homes that are being added to the tally? Are these delayed reports, or is this something that happened this week or yesterday?
No, it's based on I'll just have Caitlin. You want to talk about that? I don't want to misrepresent.
It's related to as people report cases to us. So unfortunately, as I'm sure everybody is aware, we saw almost 30,000 reported cases to us last week. And so when we think about what the definition of outbreak that we've used in a long-term care setting, right, looking for 3 or more, as you see that increase in volume. And as we've said before, we've unfortunately sort of seen this across the board. And so this is a reflection of sort of increasing activity that, we've been notified of and worked with our facilities to keep track of, and we'll be sharing.
So as soon as we get the information, they move into that status. But, they report, it goes through the system, they report the number of staff, the number of residents. This is based on the number of residents. And if they have 3 residents that test in the 14-day period, then it moves into outbreak. And then they have to be, they can't have 1 positive test in 28 days that allows, in order to move off of outbreak status. Okay, even if they would get one in the 28th day, they still remain on. They have to go 28 days without a positive case with the residents in order to move off of outbreak status.
You said the $14 million is for staffing and for testing. Nursing homes say they lack an adequate supply of personal protective equipment. May they use that money for that as well?
Yeah, and we still are providing that. So the same system is in place. I can maybe bring Jake with Homeland Security in next week, and he can talk about the stockpiles that we have with PPE, the amount of time, or the amount of items that we have, and how long that would be able to provide adequate protection based on the numbers that we're seeing. But they just need to reach out, and we're providing, I believe, the PPE to them. So there's a mechanism that they go to ask for it, and then we have located different drop-off sites across the state, and then they can go and pick them up. And we put that in, earlier spring, I think, spring or summer is when we kind of allocated the drop-off sites for the long-term care facilities and the counties to go pick up. Their EMAs can go pick them up and deliver them where they need to go. So if you're a nursing home out there and you're experiencing that, you just need to go through the system or let us know, and we will help you get the PPE that you need.
Governor, are you still confident that Tyson Foods was telling you and your team the truth earlier this year about its efforts to protect its workers, given, frankly, disturbing allegations now surfacing in lawsuits from family members who have died? And I'm wondering if you think that there's any need for greater oversight of that industry.
Well, we work with OSHA to provide the oversight. I think that's critically important. I believe that we were one of the first OSHA teams to get into these sites. But I can tell you what I did from a state perspective, and I'm really proud of that. We led the country by being able to not only provide PCR testing, but also serology testing, so that we could get into these facilities and get these into the workers tested, so we would know who was testing positive, who was testing negative, and then start to separate so that we could provide them the confidence that they needed to come to work, to know that the people that they were working with had tested negative, and to provide them that information in a timely manner. So we tested a lot of individuals in a short period of time to provide them the information that they needed. did.
Do you think the company might have been thwarting those good efforts, however, by
Well, Kathy,
having people work when they were sick?
I can't comment on that. We said this is what we can do to help. This is a critical to our supply chain, and we know we have to do everything we can in our power to make sure that we're protecting our workforce. And so in order to do that, the way that I could help from a state perspective was to help get them the testing, which was very scarce at that time. Every state across this country was scrambling to get the test, to be able to test, processing plants and just their constituents in general. And so we knew that if we were going to continue to keep the food supply chain moving and keep food on the table, we needed to figure out a way to work with these facilities to help provide them the information to protect their workforce. So we stepped up and we did that.
Governor, this is a question for Dr. Padati, actually, but Dr. Padati, in your statement, you seem to imply that people aren't cooperating with contact tracers or isolation guidelines as much as public health may like. What has that meant for the state's response to the pandemic in these recent weeks? And does that mean that did I hear right that contact tracers are only talking about household contacts?
Yeah, so I think just like everybody else, right, we recognize that everybody's feeling a little bit of tired fatigue around this, right? And we know that it is hard. We know the things that we ask them, the way that we ask people to sort of change their behaviors and interactions, whether we're talking about COVID or whether we're talking about any public health, illness or recommendation. We know that there are behavioral things that people need to do to help put in place to keep people safe, and that can be hard. So we're understanding of that. I think we also recognize, again, seeing an increase of almost 30,000 cases reported in a single week means that volume goes up, and it means that activities have gone up, and those chances for interacting between us continue to happen. And so I think just trying to work with people to help everybody understand the public health goal here for COVID has always been about limiting that spread, protecting the people who are most vulnerable, and maintaining our healthcare resources. And we've got some absolutely incredible public health professionals who work day and night and have been, for a year now to help make sure that we can provide information. But we know it's hard when information changes, when guidance changes. And so we want to just make sure that people understand it's still important to keep yourself away from others if you have COVID, and to keep yourself away from others if you had a COVID exposure, because that really does help limit that spread. And again, as we see volume increase, which has happened, throughout this response and is likely to happen going forward, we make adjustments about how to target higher risk situations. And so right now we are prioritizing household contacts to help limit that spread, particularly when we think about family gatherings moving into the holiday season and the way that we interact. Again, keeping in mind that the goal here, right, is doing what we can to limit spread, protect people who are going to have poor outcomes, and maintain those healthcare resources.
Can I follow up on the contact
tracing?
I just wanted to follow up on the contact tracing. Given the rising numbers, what share of cases that are coming through public health are you actually able to test, are actually able to investigate? And I know that you've got more staffing coming. What's the staffing level now, and what will it be after this new RFP is in force?
Well, we're at about 120 right now, is my understanding. And so I don't think it's a lack of them not following up. It's just been a little bit delayed, Kathy, because of the incredible amount of positive cases that are coming in. So if I understand Caitlin, what she's trying to say is they're prioritizing households because we know that can really spread quickly to get them the information. But that's why we're investing or bringing in additional case investigators or workforce so that we can close and narrow the turnaround time to get the case investigations done. Do you have anything to add to that?
When you're adding how many?
Go ahead. I don't know.
Yeah, so again, this is a person-to-person virus, right? So the fluctuations that we see, we have to remain flexible to. And we've seen them fluctuate in the past here in Iowa, we've seen this in other states, and we are seeing it in other states right now as well. So we think about, what are the ways that we can impact that burden? And there's many things, right? It's doing things like increasing the support we have internally at the Department of Public Health and Department of Human Services. I think we've added about 35 personnel that way. It's thinking about continuing to hire people at the state level. I think we're at around 100, still working to add approximately 20 more to that number. It's about thinking about adding external support, so, issuing requests for help outside of the department, thinking about the way we use some of those tools to make things a little bit more efficient and effective, thinking about working with our public health professionals, at the local level, and the support that they receive, and then also sharing all of the messages that reduce that activity, right? Because if we all share those messages and encourage each other to help do those things to bring down that case volume, that just all comes together to help, ameliorate that burden.
Just to follow up on the contact tracing issue, there are some estimates out there that with the rate of cases that we are seeing, that we should have upwards of thousands of contact tracers. I'm wondering, and I understand the limitations of perhaps trying to find those people, but I'm wondering if contact tracing is limited or case investigations are, people aren't returning the calls, there's an inundation of new cases. How difficult is that, or does it pose any challenges to finding out what settings are driving up the spread to inform what needs to close, stay open? I mean, it would seem that would potentially be an issue, is it?
Well, indoor gatherings, we know, so that is households as well. So we know that that's a fact. We know that that's driving the case numbers. But Caroline, that's why Dr. Pedati is here this morning, to talk about, to inform Iowans about what you need to do. If you test positive and you live in a household with other family members, then this is the steps that they need to take, regardless as if somebody has got a hold of them tomorrow. If you have somebody in your household that is tested positive, then this is what they need to do. This is what you need to do. But overall, I'm going to reiterate what Dr. Pedati said. I would just ask all of the media to help us to continue to drive home to Iowans all across the state, especially as we're seeing the escalation in positive cases and the impact that it's having on our healthcare system, to just ask Iowans to just do those simple things that we've talked about from the very beginning to protect our most vulnerable and to manage our healthcare resources and keep our hospitals stable so that they can continue to serve all Iowans, not just Iowans with COVID-19. And we're going to do the PSA. Caitlin talked about it this morning. We've talked about what Iowans can be doing on a daily basis. If you're experiencing someone in your household that tests positive, or you've come in contact with somebody that has tested positive, we're going to try to keep the test sites open throughout the holidays as much as we can, so we can continue to make that available to Iowans. We've got additional contact tracers coming in next week. I can get Kathy, I'll have Pat circle back and give you kind of the range that we're looking at. Hopefully that we'll be able to help with. But irregardless of that, that's why Dr. Pedati is here today, is just to remind everybody what they can do in the interim until we're able to do that.
Governor, I noticed you didn't emphasize masks in the PSA. Was that a conscious decision?
Oh, no. We said mask.
Well, you didn't, nobody was wearing them, and there were
No, because we were social distance. We were filming. I wanted people to be sure and know who they were. We took all precautions when we've done it. KCCI just did a great editorial the other day, just talking about we can continue to have this debate back and forth about what works and what doesn't, or we can implement the layered mitigation efforts that we know can have an effect on the virus, can start to drive the trend down and really help alleviate some of the pressure on our hospitals. And I appreciated that. It was straightforward. It was saying to Iowans, regardless of this or that, or we can discuss that going forward. But here's what we know: social distance, wear a mask, stay home if you're sick. Those are, wash your hands often. Those are things that we need to do to get the numbers and the trend down, to stabilize our hospitals, bring the positivity rates down. They also brought up, closing businesses. We don't want to go back to where we were at in the spring. We want to keep our businesses open. We want to help protect the lives and the livelihoods of Iowans. And for heaven's sakes, we want to keep our kids in school. And so let's all focus on that, the goal. And if we do that, then we are going to get this thing. We're going to get through it. We're going to get on the other side of it, and we're going to return, life back to some normalcy. So I'm just counting on everybody to do their part.
Just real quick, could you give us your recommendations? Iowa families are looking ahead to the holidays. You're talking about the household issues, deciding whether they should be getting together. What is your formal recommendation to Iowans who are trying to figure out whether they should be gathering?
Yeah, I think you need to, I think Caitlin said it, I said it in my remarks, as you gather through the holidays, we put an indoor gathering limit in place just to try to do everything we can right now to minimize the spread. So just be conscientious of your surroundings, who you're bringing in, and practice mitigation efforts. But Iowans know what to do. They'll do the right thing. They're responsible. We put targeted, mitigated mitigation steps in place, and we're going to dial them up if we need to, and we're going to dial them back as soon as we start seeing the trends change. I mean, it can't be a one day. It has to be, we have to see the trends taking place. But, we've talked a lot about and continue to talk a lot about what Iowans can do to help us do that. And so I'm just imploring that all Iowans step up and help us stop the spread, and we'll get this thing under control sooner rather than later. Thank you.